Welcome back to Houston Life. March is Colon Cancer Awareness Month, and colon cancer is one of the most preventable cancers because of cancer screenings like a colonoscopy.
And in case you hadn't heard, the new recommended age to start getting a colonoscopy has lowered to age 45. Gastroenterologist Dr. Adeeb Dwairy with Houston Regional Gastroenterology is joining us now with more on why these screenings are so important for your health. Dr. Adeeb, welcome to Houston Life.
Yeah, thanks for having me.
This is such an important conversation. We were chatting during break about all the stories in the news about people who are younger and younger getting colon cancer. And you had your own experience where at 30 years old, you had a colonoscopy because you were having some strange symptoms.
Exactly. My wife and I had gone overseas. We were traveling, had some symptoms. She was a little bit more obsessed about them than I was. I was in training, training to become a GI doctor, and she said, "You got to get a colonoscopy." And I said, "I don't really think so," but she obsessed, and I did it. And one of our partners in our group, Dr. Guha, actually did my colonoscopy. He was my attending at the time when I was a trainee. He did it. We did a colonoscopy and coincidentally found this precancerous colon polyp. And now since that time, I've already had 4 colonoscopies.
Wow.
I'm 41 now.
That's okay, and that's so young, and you know how painful the GI issues and uncomfortable they can be, and this is something that you guys really emphasize as a patient experience and care.
Exactly. I mean, there's a stigma, right? No one wants to get screened for colon cancer screening, for colon cancer, but it's so easy. I mean, the prep is obviously the worst part, but the colonoscopy is simple. We work with anesthesia. It's a very smooth process. I'm not supposed to promote this, but after my last 2, I was at the gym that afternoon, so it's a very smooth process.
Okay, that's incredible. Coincidentally, I have a couple friends who just got colonoscopies yesterday,
wow,
and someone might be wondering about the process. So describe to us what actually happens. How do you prepare for it?
Yeah, so the day before is a clear liquid diet, and it's very, very important to have that strict clear liquid diet to really bowel prep. Then you drink the prep to cleanse your colon, so that way we can have a very good clean colon when we do our colonoscopy, to visualize those very small lesions, which are the colon polyps, which is what we want to find, identify, and remove. If we can find them soon enough and remove them, we can literally eliminate colon cancer. And why this is so important, colon cancer is in the top 3 causes of cancers in the U.S., and it's still in the top 3 causes of cancer deaths.
Wow.
It's preventable. It's 100% preventable if we do early screening.
Okay, and those early screenings, who should be getting them done? Let's talk about who specifically is really not eligible, but who should be really thinking about this?
So, we say 45 is the new 50, and the whole reason why is 50 used to be the age, but we started discovering that, like me, we were missing 15% of colon cancers under the age of 50. And so we decided that we needed to move the age to 45 because actually 1 out of 5 colon cancers were actually under the age of 55. So they lowered the age. So now the new age is 45. And then if you have some high-risk symptoms or family history or other genetic disorders, we do them sooner. So definitely consult your doctor if you have change in bowel habits, rectal bleeding, abdominal symptoms or like pain, fatigue. The other one that we really specifically look for is weight loss and anemia, which is a low blood count.
Okay, so those are the symptoms then, Dr. Dwairy, we should be looking out for. Because I feel like a lot of viewers out there, we know what it feels like to have stomach issues. Mm-hmm. When do you know it's time to go see a doctor? Because the things that you just named, maybe we experience that infrequently.
So if they're temporary, obviously always consult your doctor if you're concerned and have that discussion with your physician. But it's the chronic symptoms. So if they're happening for more than a week or 2, definitely consult your doctor and they'll go through the processes with you. Rectal bleeding is always an alarm sign that will trigger probably proceeding with further testing. But early screening is critical. We find colon cancer in younger ages, and I'm a prime example, which is why this is very personal.
Right. Yeah. And we want people to know that, hey, this process, it's really, like you said, the prep is the majority of the work. You guys kind of go in and do the rest of the work. What kinds of things are you finding in colonoscopies, and what are you doing about them?
So when we're in there, and people talk about it, I want to emphasize how smooth the colonoscopy is. People emphasize that it's not so bad at all. After they get through the prep, they talk about it's one of the best sleeps they've had. So the colonoscopy is very smooth. When we're in there, we find the polyps. There's other conditions that we can also diagnose when we're doing the colonoscopies, but for screening for colon cancer screening, it's really emphasizing just to find those polyps and removing them. But the process is very simple, and you just need a driver to drive you home, and it's pretty smooth. On the prep, there's one thing to also kind of remind patients about. It's a bowel cleanse, so a lot of people actually feel better after they get prepped,
okay,
in an interesting way. So I know it's awful, but you can actually have a therapeutic
a little cleanse.
Cleanse after
as
your
a
prep.
bonus. nice feeling, right?
And also, when you mention removing polyps, so let's say during a colonoscopy, polyps are discovered, they're removed immediately. So when the patient wakes up, they wake up and you say, hey, you had some polyps, but we've removed them.
Exactly. So there's lots of different types of screening tests. So we get asked this question all the time, do I have to do a colonoscopy to get screened for colon cancer? So we always say the best test is the one that you do. So we're just promoting colon cancer screening. But the difference between a colonoscopy and the other screening test is during your colonoscopy, you're able to not only diagnose it, find the colon cancer, find the lesion that is screening for colon cancer, but also remove it. So it's a one-stop shop.
Okay, that's amazing. So you're not going to wake up and say, oh, this is what you have to take care of. Now you have to go make another appointment. You guys really just handle it then, and
you're one and done.
Right.
Exactly.
Insurance. We're tight on time, but a lot of people might wonder if this is covered by insurance, especially if they are not age 45.
Exactly. So for standard screening, most insurance plans do cover a screening colonoscopy. If you're younger and you do have high-risk factors like family history, insurance plans with the help of your doctor will also cover it. If you don't meet those criteria, your insurance will also still cover it as a diagnostic procedure. So just like any other surgery, it might not cover it 100%, but your insurance still should have some sort of part in its coverage. Your colon prep, and I did want to announce this, your colon prep is not covered. It's subject to your copay like any other prescription, but with some of our pharmaceutical friends, they have provided us 200 samples to be able to give to our qualified patients for the month of March for Colon Cancer Awareness Month. So
okay.
For our
Amazing.
patients, we do have 200 samples to provide this month to our patients.
So that's our special offer for
That's our special offer.
viewers.
Yes.
Very cool.
Let them know you want that sample. Dr. Adeeb Dwairy, thank you so much for stopping by.
Thanks for having us. We're excited.
It's a very important conversation and
Extremely.
uncomfortable for a lot of folks, but people, go out and get tested. You will be glad you did. Again, it is covered by most insurance plans. Such a good reminder, schedule your colonoscopy today. You can call 832-707-5011, or you can visit them online, hrgastro.com.